We have another 2 more minutes before 11.
Okay.
And I think we have a steady flow of participants coming in. I hope they do have questions for us later at the end of your talk. Okay, all right. Okay, it's 11 o'clock now. Encik Tino, are you ready?
Yeah, ready.
Okay, all right, great. Okay. Assalamualaikum and a very good morning to all in this today's talk, Wacanareka number 5, which is by Dr. Marik, our presenter for today. Okay, Dr. Marek Kozlowski is currently a senior lecturer at the Faculty of Design and Architecture, University Putra Malaysia. He's actually my colleague in the same department. He graduated from the University of Queensland as an urban planner and completed his master's in architecture at the Technical University in Krakow, Poland. He received his PhD in urban design at the University of Queensland. He has worked as an urban planner in Brisbane and also Gold Coast City Councils, and as an architect or urban designer for private consultancies in Queensland, Australia, Poland, United Arab Emirates, Oman, and Saudi Arabia. In 2006, he joined Gold Coast City Council in Queensland, Australia, as a senior urban designer and managed and coordinated major projects, including the Central Southport Master Plan and the Gold Coast Rapid Transit Corridor Study. He has done numerous consultancy work in Malaysia for DPZ Asia, where he was involved in various projects, including the Urban Design Guidelines for Central Kuala Lumpur. He has recently published a book, Kuala Lumpur Community Infrastructure and Urban Inclusivity with Roulage, Taylor and Francis. So for today's talk, Dr. Marek will be giving his insight on the impact of COVID-19 on urban areas, the importance of urban culture. So I give the floor to you and let you share your slides.
Okay, I'm doing it. Okay, and start from the beginning. Okay, good morning and welcome everybody. Well, I guess that most of you are pretty sick and tired of the word COVID. And I can understand that because it's the same with me. I just can't wait until things will get to normal. But having said that, I don't want to paint a gloomy picture today. And I don't want to make you more depressed. Actually, I want to sort of like give you all and give us all a little bit of hope. And based on history of pandemics, I want to sort of like indicate that there's a very good chance that our world, our livelihoods and our urban environment will be better after this COVID. Well, COVID came as a shock to everybody, and it left the political establishment totally unprepared and for it, and although they were warned many times that this might come. And the SARS that occurred in Hong Kong in 2001, 2002 was an indication that that might come globally one day. So it's not that they didn't know anything about it. But basically, this whole pandemic has proven one thing, that our economic system, based on neoliberalism and based on property-led development and this fast-track growing and globalization and economic figures, is absolutely non-resilient to pandemic. And neoliberalism has proved to be I would say, a failed approach. And it's amazing that we can send drones to Mars. It's amazing that we can clone other people, but we cannot deal with a virus. And okay, I will not call COVID a mild virus because it killed 3 million people globally. So it's not, you can't call it a mild virus. But I will prove to you that out of all the viruses and pandemics that humanity has encountered in the past, this is not as severe as many of them, far less severe. And yet the world is fragile, the economic system is fragile, and governments cannot cope with it. And even after a year, they cannot cope with it, and they go back to square one, imposing lockdowns, which is happening now all over Europe. And luckily, although the economic system and the political systems have failed us, but scientists haven't. Scientists have developed these amazing vaccines within a period of less than 1 year. And thanks to them, there is hope and light in the tunnel. Basically, this research was very much inspired by one of my colleagues, Professor Quentin Stevens from Royal Melbourne University of Technology, who in last year, exactly in April 2020, he drafted a short paper with 2 of his colleagues. The paper was titled, "We Can't Let Coronavirus Kill Our Cities, How We Can Save Urban Life." And basically, he identified that now is the time to create this global public space revolution in the cities, to actually take over space in the cities, because during pandemics, internal spaces cannot be overcrowded. So how can people still use the city? They can use the cities if you use all the public spaces, if you eliminate most of the lanes for cars and give them to pedestrians, give them to people to sit and relax, so people can be spaced out in between each other. So that is possible. And maybe that will be the next sort of like step in sort of like our urban development. Okay, in terms of the whole research, this research is divided into 2 phases. Phase 1 analyzes COVID in urban areas and sort of like identifies solutions and looks at the shortcomings of the whole pandemic period. And part 2 will identify a strategy for post-COVID urban areas, and will focus very much on Malaysian cities. How can those strategies be implemented? But part 2 will not so much focus on the design issues, of course, that also, and I intend to involve my students in it, but mainly of how can those design issues be implemented within the current Malaysian legislation, because we can produce all great design solutions, but how can they be implemented within the existing legislation, planning framework, all of that? What needs to be amended for those all those amendments and design proposals to be implemented. And part 1, I'm doing part 1 now. So today we're going to look at COVID in urban areas around the world. And I've focused on 2 of my countries. One of them is Australia, and the other one is the European Union, because I've been following what's happening with COVID in those 2 countries. And the methods and techniques I used here are basically not only secondary data collection, so not only websites, but also interviews. I interview people. I interview families and people in Australia, in Taiwan, in Thailand, of course, in Malaysia, in Poland, in the United Kingdom, in Finland, in Germany, in Netherlands, and even in the United States. So I've managed to do quite a significant number of interviews with people, because actually it's the perception of people that best portrays what is actually going on the ground in several countries. When you listen to mass media, you just get figures and all those gloomy reports. But when you listen to people, they will tell you, well, yes, it is like that, but, and so it's really interesting to get the subjective opinion of people. And I intend to continue doing more interviews. I definitely want to interview people from South America, because South America has been badly hit, and people from Africa, if I can get any respondents there. Okay, I'm going to talk basically about the history of pandemics, about combating COVID-19 around the world. Implications of lockdowns, and implications of lockdowns for cities are tragic, as you all know. Failure of the European Union versus the success of Australia, the vaccine rollout, and how urban culture actually influences, and COVID-19, how they go together, and how it is in some countries almost impossible to enforce a lockdown. And about then, last but not least, the major component is the post-COVID urban environment. Okay, well, if we look at the history of pandemics, and you've got all the pandemics, there's COVID, there's AIDS, which of course is a different type, because AIDS is through sexual transmission. So although it killed 35 million people, it wasn't as severe, it didn't have any severe implications on our economy and livelihood, because all you had to do was to have safe sex. So that was the issue. But then there's one other, there's this 1967, 1968 Hong Kong flu that I remember as a child. I was then in Poland, and I remember our school was closed. And as you see in the figures, 1.1 million people died because of this flu. Or you can say, well, that's much less than COVID. Yes, but remember, the world population then was half of what it is now. So, and considering that this happened in a period of 5 to 6 months between November and May, this is quite a significant number. In Poland alone, 21,000 people died because of this flu. And I remember schools being closed, and I was really happy because we didn't have to go to school. So I remember that well. But then when I read through the transcripts of what happened then, it's clear that there was no shock and frenzy as it is now. So it didn't have an impact on everyday life as COVID has now. And basically, well, it was pretty short, because as I said, it was only 5 to 6 months. And secondly, it was a flu, a seasonal flu, a worse seasonal flu. And every year in Europe and North America, we have seasonal flus, so we're quite used to it. But secondly, well, people traveled much less. There were no, in many countries, there were no shopping centers, no major congregation areas. So it was kind of easier. And there was no globalized media. So there was no media frenzy. So nobody was actually, portraying all those gloomy statistics and all of that. So it went through quite smoothly in comparison with COVID. But I'd like to turn to the Spanish flu from the 1918, 1920, which actually resulted after the First World War. The soldiers brought it back, and it killed at least, and this is a very conservative estimate, at least 50 million people. And you must remember that the world population then was only a third of what it is now. So in order to COVID to match the Spanish flu, COVID would have to kill 150 to 200 million people. And we all know that's not going to happen. So it was a very much more deadly pandemic. And one thinks, well, this deadly pandemic came after the First World War, and it didn't leave that much shock on the world economy, impact the world economy and the livelihood of human beings then as COVID now. And I tried to think what was the reason that, this deadly pandemic, Spanish flu, was less impactful on human lives than COVID. Well, there's three reasons. First of all, there was no globalized economy. People didn't travel then. People didn't, there was no globalized connections and interactions. So it was all confined to various countries. Secondly, human life didn't matter that much then. I mean, it was 100 years ago. So if you died, especially if you were poor, you died, well, you died. I mean, there was lots of epidemics around, so it wasn't something a big news. And thirdly, last but not least, there was no global media. There was no media frenzy, no CNNs, no Sky Newses, which are blasting all that gloomy information, statistics, spike of cases here, spike of cases there. There was nothing like that. So it didn't really have an impact on the livelihoods of people as COVID has now, although it was much, much more deadly and severe. But one, well, I don't know how to say positive aspect of Spanish flu from the medical point of view was that in COVID, as you know, 30 to 40% of the affected people don't have any symptoms. So it's very difficult to actually detect them unless you test everybody. Spanish flu, you had symptoms from the start, high fever, vomiting, etc. So Spanish flu was much more detectable. But if you look at other serious pandemics like the third plague, cholera pandemic, Black Death, of course, that was killed 1/3 of the world population, and the Justinian plague that killed 25% of the world population. One thing is quite clear is that none of them changed the course of history. None of them actually destroyed a civilization. But climate change, yes, it changed the course of the history and destroyed a few civilizations. So this is something that is sort of like one of the findings from all of this, that although pandemics are deadly, they are usually short, a few years, and they come and go. While things like climate change have repercussions for centuries, centuries, and centuries. Now, to indicate the non-severity of COVID, I would like to give you a bit of statistics from Southeast Asia. And in Southeast Asia, for unknown reasons really, the strain of COVID is very mild in comparison with Europe, North America. If you look at the world average mortality rate, it's 2.13%. And let's look at Malaysia. It's only 0.36% of the total cases. And okay, in Malaysia, they have only done 261,000 tests per 1 million population. So probably the number of cases is much higher than the official one. However, in terms of death, it's probably quite accurate because every death in Malaysia, Singapore, and Thailand has to be medically certified. So you have to write the reason of death. So I would say that this figure is quite accurate. And if you compare the deaths from COVID, for instance, with diabetes, with ischemic heart disease, which is only heart attacks, I'm not talking about strokes and cardiovascular diseases, just heart attacks, and pneumonia and influenza, they're listed together, they're not separated. You can see that 13,000 people in 219 died from pneumonia and influenza, almost 10 times as much as from COVID. If we go to Singapore, that's even, this gap is even bigger. In Singapore, 30 people died from COVID in the whole last year. And if you look at other deaths, it's much, 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 much bigger. So the gap is much, much wider. And Singapore is the only country in Southeast Asia where they went for absolute mass testing. They've done 1.5 million tests per 1 million population. They tested every foreign worker at least twice there. So Singapore has, figures from Singapore are, I would say, very accurate in that case. So Southeast Asia is a good sort of like indication that in some parts of the world, the virus is not that severe. The other part of the world is Africa. To everybody's surprise, everybody was thinking that Africa is going to get it. It's going to ruin the livelihoods of people. It's going to be a tragedy there. It's not. It's not. Until now, of course, things can change. But until now, the strain in Africa is not deadly as it is in Europe or North America. Now, when the governments were encountered with COVID, the first thing they went to is imposed lockdowns, and they imposed lockdowns practically all over the world. The Chinese were the first one to impose a very rigid lockdown in all of it. Started first with Wuhan, then all of the other major cities and throughout the country. But other ways to combat COVID is, of course, testing, and only, I would say, mass testing is the best way to do that. And by mass testing, I mean what they're having now in, for example, in Germany, that you walk along the major street of the city and you've got tents and you can get a rapid test within 20 minutes and get the result. This is the way actually to detect as many people as possible. Of course, imposing social distances, contact tracing, something really important, something that Malaysia has adopted, and something that it really is one of the very good tools to fight COVID. And the other one is vaccines. Of course, vaccines are our best hope, but with vaccines, it's not only a matter of producing them, it's a matter of distributing them and managing the vaccination process, which I will point out to you is not an easy task as one would think. It's quite a difficult task. Now, in terms of lockdowns, my sort of like analysis revealed that the first lockdown everywhere in the world worked well. Worked well because the people they didn't know the virus, they were quite skeptical of what it is, they supported the governments who imposed those lockdowns, and they were quite compliant with the regulations. And even in countries that usually they don't like to be compliant with government regulations, like France, Italy, Poland, they still sort of like obeyed to the rules. So that was the first lockdown was successful. Second lockdowns, third lockdowns are not successful anymore because people don't trust. People think, oh, if the government had a year to address this issue, and after a year they're going back to square one and locking down, well, there's something wrong. And this trust in government is going down and down and down. And in Europe now, it's the anger. When I interview people, the anger among people is enormous. The only reason there's no major outbreak or revolution is because the vaccines have been rolled out, and there is some light in the tunnel, although vaccine rollout in Europe is very slow. Only UK has done a good job on it, but not the rest of Europe. But still, people believe that, well, by summer, normality should slowly, gradually return. But as I said, usually the first lockdowns are successful. And in terms of lockdowns, it's not only the economy that has an impact. Actually, at the beginning of this whole pandemic, the gloomy mass media was saying that it will be the situation will turn into a depression from the 1920s, 20% people out of work. Nothing like that happened. Nothing like that happened. I read the new statistics from the UK, and 5%, there's the unemployment rate, there's 5%, a little bit higher than 2019, but not much. So this gloomy sort of like prediction of return to the 1920s depression, that didn't happen as yet. In terms of the impact of lockdown, it's very bad on social interaction and extremely bad on community well-being. if you read about the numbers of mentally sick people seeking help, it's like 2 to 3 times higher than a year before. So this is, and that's based on UK figures. So this is bad. It's not only the economy that it hurts our community well-being. Now, how lockdowns are successful or not? Yes, as I said, the first lockdown was successful, and logically, if people comply with the regulations, they should be successful because you are limiting interaction between people. But I can give you a few examples of lockdowns and statistics between countries that imposed lockdowns and countries that didn't impose lockdowns. And you'll see that the difference is not that great as one would think. And this is a good example, Argentina. Argentina has had the biggest lockdown of all the countries. It had 304 days of lockdown. Now they've opened up some branches of the economy because they can't cope anymore. 42,000 businesses are closed permanently. That's a huge number. Economic contraction, 19% in the second half of 2020, and one of the highest in the world. And there's growing and growing community anger. Did it have an impact? Has Argentina less cases and less deaths than other countries? The answer is no, it doesn't. It has probably a higher number than other countries, considering that it's done less tests. But let us look at some figures, for instance, and let us look at, in yellow are the countries that didn't impose lockdowns. In gray are all those countries that have imposed lockdowns. Let's look at Europe. UK, they had 2 major lockdowns, one in the beginning and then one in November. It just ended now in April, on the 9th of April, because of very successful vaccination rollouts. So the number of cases in UK has really dropped dramatically. And in terms of, because you always measure, you should measure the impact on COVID not in the total numbers, because that's not really indicative. You should measure it in terms of cases per 1 million population and deaths per 1 million population. Then you get the actual number of how the country is performing or not. Because you must remember that a country can have a population of 10 million and another country can have a population of 70 million. And of course, the country of 70 million will have more cases and deaths than the country of 10 million. So you always do it cases per 1 million. You never put total figures, because that's not really, that's sort of like deceiving very much. It's not really gives you the actual picture. And if you look at the UK, number of cases, compare it to Sweden. Okay, in number of cases, it's got quite significantly less, because 64,000 cases compared to 88,000 in Sweden. But then if you look at the death rate, Sweden has less. UK has 1,867 and Sweden 1,359. Why is that? That's the reason is that Sweden, although they haven't done lockdowns, but, and I'm not promoting Sweden. I think that in terms of Scandinavia, they're definitely one of the worst performers in Scandinavia. They've got much more cases than other neighbors. So I'm not promoting Sweden as a good example, don't get me wrong. But what they did in Sweden is they secured the elderly and the vulnerable very quickly, although they didn't have a lockdown. And as a result, as you see, they've got less deaths than the UK. Okay, let's compare Sweden, which has the same population, with Belgium. Well, as you see, in terms of cases, it's very similar. And in terms of deaths, Belgium is double. And Belgium has been imposing lockdowns at least 6 months of, at least half of the COVID period. Belgium is under partial or full lockdown, and yet it's not doing. It's doing worse than a country which has not been under lockdown. Okay, let's look at the United States. And I've picked 2 states, Florida, Texas, California. Florida and Texas, Republican states, pro-Trump, so of course, no lockdowns. Yes, no lockdowns. California, Democratic state, actually a very energetic and good governor. Houston. But if you look at the statistics, and California had 2 lockdowns, now it's got up sort of like, it's still under some partial lockdowns, more or less comparable to what we have here in Malaysia, that most of the places are open. Well, basically, if you look at the figures per 100,000 population, they're quite comparable. And the same with the death rate. It's quite comparable, a little bit less, but not much. Okay, Argentina, yes. Okay, Argentina's got less than in terms of cases than UK and Belgium, but a big but, it's got only 223,000 tests per 1 million population, and UK has almost 1 million tests. So the figures from Argentina are not accurate in terms of cases. I think there's much more. If Argentina did mass testing, it would probably be somewhere close to Belgium or even higher than that, although they've imposed a full lockdown for almost a year. And the last figure I want to give here is something completely different, because there is this perception that if tourists travel, if we travel, then the cases will spike. And yes, however, you can control that. And Maldives, for them, it was open up to tourists or perish. Basically, their contraction was minus 27%. So then they had no choice. They opened up for tourists, and they imposed that they'll let anybody with a negative COVID test into the country. Now they've extended that to vaccination. So if you have a vaccination negative test, then you can enter the country. And as a result, their tourism went up. They had in January 2021 as many bookings as January 2020. And has it really impacted the number of cases? Well, not really. And they've tested all the citizens there. They've got 1.2 million tests, and there's 48,000 cases per 1 million population, which is half of some of the American states and European countries. So it didn't create this spike, a catastrophical pandemic because of tourists. If you can control tourists, if you let in the tourists that got negative tests or are vaccinated, you're pretty safe. And Maldives is an example. Another good example is Spain now, one of the few countries in Europe that's not really experiencing a third wave. Well, they are, but not to the extent of France or Italy. And since February, they're letting tourists in, of course, with a negative test. And it did not, it did not impact the number of cases in the country. So, conclusion from this, okay, lockdowns do work in some scenarios. As I said, the first lockdown works, and they definitely should actually prevent more cases and try and contain the virus. However, if some politicians, I remember Boris Johnson once sort of said that if we didn't do a lockdown, we've got models that 500,000 people would die, 600,000 people would die. Well, I don't know where he got the model from, but definitely, as you see, and correct me if I'm wrong, those statistics here do not indicate that this would be the case. Yes, they would improve the situation by 20-30% less cases, maybe less death, but not 5 to 10 times like some of the politicians like to portray to us, that if not lockdown, it would be 10 times more deaths and 10 times more cases. That's not actually supported by those statistics. Okay, and of course, impact on urban tourism is enormous. Those are most of those photos I took, and I took those photos not during lockdowns. I took those 2 photos from Malacca are during the end of the year, between Christmas and New Year holiday period, where actually most of the hotels in Malacca were all booked out. And yet, if you look at lunchtime activities along Jalan Jonkers or outside the Stuthaus, you hardly see anybody. And I talked to a few people and a few families in the hotels, and they said, okay, they brought their kids, but they're not really keen going out. They just want to sort of like enjoy the hotel facilities. So although the hotels were booked and a lot of people went to Malaga, they were not keen to go out and to the city. Of course, in the evening, the activities have picked up a little bit, but not that much. And a lot of the places are permanently closed. Those two, this photo is from Langkawi in late September, early October. So as you see, a little bit of activities, but not that much. This is Petaling Street, which, well, now the cars can go through there, so it's lost its sort of like character and ambience. And this is, I think, one of the most affected areas, Batu Faringi in Penang, which at lunchtime, that was done in August when they opened the state borders. Apparently, it's a bit more vibrant now. I've interviewed one resident from Penang. He said it's a bit more vibrant now, but still, it's nothing to the vibrant Batu Faringi from what we remember pre-pandemic. And this is Thailand, Phuket. And as you see, it's very much impacted. Okay, the situation in Europe in terms of urban tourism is, well, I don't know what it is now, but as you probably all know, the European Union opened up from June until October. So a lot of the businesses could actually cater for foreign tourists from other EU countries. So maybe the impact is not as big as it is on those images here. Now, it's good to listen to lockdowns, to the opinions about lockdowns, not only from politicians who will try every word to say that it's good because it saves lives and all of that, or from economists or business operators who say it's tragic, destroys their businesses. So I like to listen to the opinion about lockdowns from epidemiologists, so specialists in virusology and specialists in viruses. And I sort of like to listen to two professors. One of them is Professor Sunetra Gupta. She is professor of epidemiology from the University of Oxford, and she is a lockdown skeptic. She believes that the first lockdown, yes, that was good, very quick, very sharp lockdown, but then not repeating it because it has a detrimental effect on the mental well-being. She's concerned with mental well-being. She's not that concerned with she's not an economist, so she's looking at the mental well-being of the community, and she supports a full protection of the most vulnerable rather than locking down 2 or 3 or 4 times. Okay, an American professor who is now and the founding director of Global Health Governance, Professor Devi Sridhar. She is on the opposite side of Professor Sunetra Gupta. She actually supports lockdowns, but she supports lockdowns on one condition, that they're short, they're quick, and that each lockdown has a recovery strategy. So you do a lockdown and you say that it will last, say, 3 to 4 weeks, and after that we will open this, and in 6 weeks' time we will open this, and in 8 weeks' time we will open the airport and our borders. She said this is the only way a lockdown can work, and this is the only way the community will actually try and fulfill the requirements of that lockdown. And surprisingly enough, the latest lockdown that the British government imposed is exactly like this. It's got dates, specific dates. They said on the 10th of April, we will open restaurants. On the 20th of April, we will open gyms. On the 17th of April, we will open international travel to countries that are less affected. And they're keeping up to it. Of course, they're doing a mass vaccination work, but they're keeping up to it. And it seems to work. And people seem to support it. There was Boris Johnson a year ago was even just as unpopular among many of my British friends as Donald Trump was. But that's not the case anymore. I mean, I'm not saying they're going to vote for him, but they think he's doing quite a good job. He's done a lot of mistakes in the past, but he's doing quite a good job now. And there seems to be a growing support from what's happening now in the UK. And anyway, I watch UK and I follow the UK situation on Sky and BBC on daily basis, so I can see that there is sort of like good feedback from the community. Anyway, this is something that really struck me, that epidemiologists, one would think they would be all into lockdowns. Yes, let's lockdown, let's lockdown. No, they're not. Absolutely not. Okay. And a few, this slide I presented to my students a few weeks ago, and I've indicated countries that can be named as, so not a few weeks, but a few months ago, as successful against COVID, and those are the countries here. I indicated that Thailand and Vietnam, okay, they have a low number of cases, but they have also a very low number of tests, so we don't know really the real results. But I told them that this situation can change because it all now depends on the next step, which is the vaccine rollout. And I was right. Now this list would be slightly different, and I'll come to that later. And you must remember that there's a few stages in combating COVID. One of them is combating and treating the virus. Then the second one is managing and distributing the vaccine rollout. And this is really important. It's not as easy as one would think. Then it's the post-recovery phase. How do you recover from COVID? And then reinstating the worst hit industries, which is tourism and culture. So I would say those are the 4 stages of it, and we are now in sort of like in between this, so slowly going into managing and distributing the vaccines and still combating, treating the virus. So we're not even in, when you look at a football match, we're not even close to, we're a bit close to half time, but it's not the end. The end will come when there'll be a recovery, and then we can start assessing countries, how they manage the whole process. Okay, I'll give you 2 examples. European Union's failure story, how it failed. Okay, when they imposed their first lockdowns, they actually were quite successful. Even countries where people don't like to comply with regulations like Italy, Spain, came out of that lockdown quite victorious. So immediately they opened their borders, they opened all the pubs, restaurants, you name it, no requirement for masks and all of that. And as you see, those are images taken by some of my friends from Europe. This is Paris, a nice July evening in around Montmartre. This is a beach in Spain. This is a restaurant somewhere in Germany. So as you see, absolutely normal life, no social distancing, no nothing. And as a result, the consequences were bad because the second wave came in October. However, okay, I'm not saying that all those travel and holidays didn't contribute to the second wave. They did. But the main contributor to the second wave was actually opening, it started in October when people came back from holidays, and it was actually opening the offices and schools. They opened the schools without doing testing. Now in the UK, they opened schools 2 weeks ago. They tested every kid. Every kid was tested before entering school. And that makes a big difference. There's no impact on schools and the rise of COVID at the moment now. And of course, in October, November, there was a significant impact. So that was the main mistake. The second mistake was that they didn't what Malaysian government has done really well, contact tracing. There's no contact tracing in Europe at all. You don't have to scan your phone. I mean, it's not a big deal. As we all know, how long does it take you to scan your phone and put your name? 30 seconds, 40 seconds? Well, there's nothing like that in Europe. They tried in a few countries, but actually it failed. And this is their biggest mistake, that they didn't impose contact tracing, and it's very difficult for them to actually trace a cluster, where it came from, where it originated, where it went. So that's why they have all those spikes. This is their biggest mistake. Second one is lack of mass testing. Now they're doing mass testing. They should have done that in September and October. They're doing it now. And thirdly, of course, they didn't prepare for a second wave, although everybody warned them that it could come. They didn't prepare. They didn't increase the hospital beds. They didn't increase the number of trained nurses. They didn't do anything. They thought they won the battle against COVID. So as a result of those mistakes, they've got the huge spike, second wave, and now they're experiencing the third wave, which is sort of like, and they're trying to mitigate that third wave with the vaccine rollout. And it is, in some countries like the UK, succeeding very well. In some other countries, not well at all, because the vaccine rollout is too slow. But then, even in Europe, there's discrepancies between countries. If you look at Finland, Finland has 15,000 cases per 1 million, and the Czech Republic has 149,000 cases, so 10 times almost the difference. So this is something that will come later, culture. The Czech Republic can impose a lockdown, Finland can impose a lockdown, but in Finland people comply even if there's no lockdown. In the Czech Republic, it's something completely different. And Australian success story. Well, in Australia, they really focus a lot on contact tracing and mass testing. They have like 635,000 tests per 1 million population. So they actually tested almost every adult in the country. And also the success of Australia is that COVID health is decentralized there. It's with the jurisdiction of the state governments, not the federal government. The federal government has no say in whether Melbourne or Sydney or Brisbane will impose a lockdown or not. It's up to the state premiers, not to the federal government. And I think that one, and working with the community, which was very much promoted in New South Wales, for instance, created a situation where the number of cases in Australia is really low, is 1,148 per 1 million population. And for the last 4 months, if there's any cases in Australia, there are many imported cases. So Australia has really managed to contain the virus very well. However, you can't proclaim them the winner because they're very slow in the vaccine rollout. And they're betting on the fact that, well, maybe there won't be any spikes or anything or any new clusters. Maybe there won't be, but they're really, really slow on the vaccine rollout. So the winner now is under threat because, well, the vaccine rollout has been actually not monitored and managed well. And this is the federal government's responsibility. So the good work by the states was actually in some ways jeopardized by bad response of the federal government. But I would like to point out the different attitudes to culture, and culture is extremely important in terms of COVID spreading out in the community, in the urban community. Now, if you look at those images here, Korea. In Korea, there was no lockdown. All the businesses, premises, with the exception of nightclubs, were open, and they're open all the time. And they have managed to contain, with no lockdowns, they've managed to contain the virus. There's like 500 to 600 cases a day in South Korea, and South Korea has a population of 55 million. They did it mainly because of very good, efficient contact tracing, but also because of population. The population actually obeys to the regulations. They keep social distancing. They obey to the rules. Now that is completely different in countries like Poland. This is a scene from the major ski resort in Poland done in February this year. And in United States, this is a scene from an outdoor party in Miami in March 2021, where a lot of people think, oh, well, we've got the vaccines roll out now, massive vaccine in the US, so we can party, completely different attitude. And also culture. Now, the social interaction between people in Europe is much bigger, and this is sort of my observations, than it is here in not only in Korea, but all over Asia. The way you greet people, when a man meets a woman or two women meet, you have to give them, in France, it's called il baiser, 3 kisses. And that is actually a ritual, an absolute ritual. It's rude not to do it. And as you see here, that picture above, you see the French President Macron kissing the Danish Prime Minister, because that is actually the culture. It's been like that for decades. And this is actually something very difficult to manage and control by law. So, as I said, in Scandinavia, they also have kiss greetings, but in Scandinavia, it's not a ritual. They can do without it. Countries like Italy, France, Eastern Europe, it's very difficult to erase that because it's been, as I said, tradition for centuries. So this is one of the reasons that it's very difficult to impose restrictions and lockdowns in Europe. And of course, the vaccine rollout. As I said, if I was doing that talk to you 3 months ago, the worst performers in the world were the UK, US, and Israel. Now they're the best performers. Israel has actually vaccinated 70% of its population. And they've actually opened everything. You can, of course, travel, subject that you have a vaccination certificate. So, and yesterday I heard that they actually no longer require people to wear masks. So they've actually totally controlled the virus. And while other countries have a very, very slow virus layout, like Australia, New Zealand, Malaysia, Japan. And Japan, I'll come back to Japan. Japan was hosting the 2021 games. And those games are under threat now. And this is quite unbelievable because they knew they were hosting the games. And yet they didn't secure the vaccines. While some countries, I mean, okay, you can say that there is an Anglo-American Jewish conspiracy and they secured all the vaccines first for themselves. There could be some truth in that. But then there's some countries like Morocco, poor countries like Morocco. Morocco has vaccinated 20% of its population. Serbia, 18% of its population vaccinated. So what was the Japanese government waiting for? They knew they were hosting the games. They knew it's critical to vaccinate the population of, say, the greater Tokyo area where the games were going to be held. And they haven't done anything. So that is something, so as I said, we can only judge the performance of each country after the recovery period to see how it coped with the whole process. And those are a few, because now you listen to the media and they talk about the third wave and all that you hear is spike, 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 spike. But they don't tell you one thing. Yes, there is a third wave, but thanks to that even slow vaccination rollout, the number of deaths is declining. And you can see daily deaths in Denmark. Look how it's declined since February. Daily deaths in the Czech Republic, which is the worst performer I think after Brazil, it's the worst performer in the world. And yet the number of deaths is declining. Netherlands, where the cases are going up now, but the number of deaths is declining. And Portugal, where you can see a very rapid decline of death. And this is as a result of, okay, a bit of lockdowns, but the vaccination rollout, because they've managed to secure and protect the most vulnerable population. They've vaccinated the elderly and the sick people. So that's why the curve is going down. And this misinformation is terrible. A few days ago, I heard one of the main CEOs from World Health Organization saying that there is a spike everywhere, the third wave, the cases are going up. Well, that is true and partially true, but not explicitly explained. The number of cases have risen in the last few weeks by 300,000. So there's like 700,000 cases a day globally now, comparison to 450,000 3 weeks ago. But that's mainly because of one country, India. India, 3 weeks ago, had 20,000 cases. Now it's got 320,000 cases. So a 300,000 case increase. And that's because, and that's why the number of cases is such a, so you can see how misinformation is actually not helping with combating this virus. They should indicate, yes, there is a spike, but it's mainly as a result of what's happening in one country, which is India. And some positive outcomes from pandemics. As I said, pandemics have happened, and in the 19th century, we, as a result of the pandemics, the urban infrastructure was introduced, urban planning was introduced, the sewage system was introduced, fresh water was introduced to the city as a result, direct result of combating all those pandemics and epidemics happening in the urban areas. After the Spanish flu in the 1920s, the Spanish flu had a major impact on the way architecture started to cities started to build. The whole idea of new modern houses with fresh sunlight, spaces in between buildings, improvement of working conditions, designation of areas for parks. This all happened in the 1920s and 1930s. And this was, in some way, a direct response to the Spanish flu pandemic. So create a better environment, create a less congested environment where people would enjoy some public open space, where they would have better housing conditions, because the congested housing and bad housing conditions are a major contributor to increase infections. And this is a website that I won't discuss it much, but they've done a website actually, and this is done by the UN Habitat City performance tracking of cities. And this actually looks at 1,400 cities around the world, and it looks at the readiness against the pandemic. And those are the criteria: public health capacities, social strength, economic ability, infrastructure, national collaboration. And it covers 1,400 cities. This is the website, but this is based not on tangible research, but this is based on interviews with people. So this is based on subjective opinions of people. However, it is a good indicator how cities can perform against the pandemic. And one conclusion from this: American cities perform just as bad as cities from some cities from the third world. Now, in terms of COVID and high densities, well, COVID is generally an urban pandemic. It's not a rural pandemic, and it increases in high densities. And in Europe, cities like London, Paris, Madrid, Barcelona, New York were really badly hit. And the number of cases in London in January during the peak was 765 per 100,000 population. If you compare the Kuala Lumpur metropolitan region at the same time, when we had our spike, it was only 148 per 100,000, so about like 6 times more than we had here. And the ideal safe number by WHO is 20 people per 100,000. If you have less than 20 people per 100,000, that means you are in control of the pandemic. But there are some cities around the world which are very congested: Hong Kong, Taipei, Singapore, and they've performed really well, especially Hong Kong. I mean, I won't argue that the Chief Minister, Carrie Lam, she's very much criticized for her human rights sort of like atrocities and all those issues related to freedom and human rights and democratic rights. But then in terms of her managing COVID-19, I would give her 9 out of 10. She did a tremendous job. Hong Kong didn't really experience any major spike. Okay. Dr. Wan, can we go over a little bit, 10 minutes more, or?
Yeah, I'm fine with it. Mr. Tino, is that okay? Yes?
Yeah, okay.
All right. Okay, Dr. Marek, please proceed.
Okay. Now, those are sort of like a few scenarios regarding pandemics. Well, definitely in a situation like that, in a very congested environment, this is where pandemics, epidemics, you name it, spread really quickly. That's why countries in South America, Peru, Colombia, Brazil, because of housing conditions like that, it spreads really, really quickly. In big towers, it also can spread pretty quickly. We remember during the first lockdown, Menara 2 in Masjid, India was locked down for about, it was under EMCO for about weeks and weeks and weeks. And I read some interviews with the residents there, and it was an absolute trauma for them. So this is also, I think, something that designers and planners should consider in the future, how to improve livelihood, how to make those high-rise residential towers much more resilient to pandemics than it is now. And of course, in a low-density environment, that's where it's the easiest to cope with pandemics. That's where they don't spread out too much. Maybe that's one of the reasons that Sweden has managed to do it better than Belgium without lockdowns, because Sweden is not congested, it's not highly dense, while Belgium is very highly dense. So this could be one of the reasons. And what a few urban professionals say about the urban crisis. Well, here's some positive opinions from them. Like Professor Richard Florida, an urban planner, he reckons that the crisis may provide a short window for our unaffordable, hyper-gentrified cities to reset and re-energize their creative scenes. So this is a positive thing, that looking back at history, pandemics were damaging to cities, but then the post-pandemic period was actually benefiting the cities, because people were changing the cities to make them more resilient to pandemics, to those. And this should be the case after COVID. Well, you all know this name, Norman Foster. They just asked him a specific question: is COVID going to change our cities? His answer was very direct and short: no, it's not going to change our cities, because people are used to the way they are living. However, he said it will sort of like trigger and encourage the urban managers, the city management authorities, the professionals to actually design and plan, so we are more prepared for an eventual next pandemic. Bjerke Engels went even for one step ahead. He actually identified 5 criteria for a new post-COVID city: biophilia, which is the integration of nature and the built environment; rethinking luxury. He said that luxury should be based on local materials, not imported materials. It should be different. It should reflect the local tradition. Rearrange living spaces. Definitely something that he's promoting is balconies as a room. So basically that every residential apartment in the city should have a balcony, which should be an additional room that they can use in summer. And even in winter, when it's cold, they can put a glazing partition and use it as their winter room. So this is something that he's very strongly promoting in his designs anyway. And he's also looking at redesigned thoroughfares. So he's very much in favor of actually what Quentin Stevens and his 2 colleagues were, of actually taking over the cities. Let the people, the pedestrians, take over the cities. And actually, cars and pollution, they are a contributor. Polluted cities have an increased number of cases and deaths from COVID than cities that are not polluted. So this is an interesting observation, and definitely limited traffic in a city makes that city much more resilient to the pandemics. And we've seen that together with a few of my colleagues and a few students, we've seen that fantastic 8 building by Bjerke Engels outside Copenhagen. It's actually in Copenhagen, the outskirts of Copenhagen. And it's, I think, in terms of lockdowns and COVID, it's very resilient because it's got a lot of informal outdoor, semi-outdoor spaces. It's got a communal space. On the ground level, they have got all the basic facilities from kindergarten, small school, children's playground, grocery shops, even a hairdresser, medical clinic, you name it. So it's actually a place that is already resilient to future pandemics. Okay, the United UN Habitat, they have actually published an interesting manual which targets the post-pandemic cities, and they're looking at rethinking the urban form and function of the city, addressing systematic poverty and response to pandemic, rebuilding a new normal urban economy, because as I said previously, our economy at the moment is very fragile. It's not resistant to a virus that's not the most severe virus that humanity has experienced, and clarifying urban legislation. And one of the authors of that manual was a Malaysian lady, Mamuha Mok Sharif. She's the Undersecretary of the UN Habitat now. I remember her. I met her at the World Urban Forum in Kuala Lumpur in 2018. And she is a very passionate person regarding to our future urban areas. And I think she's doing a very good job in UN Habitat. And now a little bit about what they identified there, interrelation between pandemics and climate change. There is quite a significant interrelation because all the deforestations that are happening, they're actually bringing animals closer to the urban areas. I mean, London has experienced in the past few years a large increase of foxes in the city areas, in the city suburbs, something unheard of when I was living in the UK as a child in the 1970s. That was absolutely unheard of. Now it's quite common. So they're bringing animals close to the city. As you know, most of the pandemics generate from animals. So this actually increase is animal habitats are key to emergence of zoonotic diseases. So they actually increase the interaction and between humans and animals and actually make humans more vulnerable to diseases because of the closure of animals. Second thing is water-related viruses. Well, of course, flooding. Flooding has increased. Jakarta has got flooding a few times a year, and they also bring viruses with their floods, dirty waters. So this is also as a result of climate change. And last but not least, poor air quality. Definitely, this is proven, identified that poor air quality contributed to the increase of COVID deaths and increase in COVID cases. So this is, for air quality is extremely important as something to combat pandemics. And as you see, there is close interrelation between climate change and pandemics. So if you're actually planning and designing for climate change, you are also planning and designing to be more resilient against pandemics. And this is already happening all over the world. This is Vilnius in Lithuania. This is Melbourne, Australia. This is, I think, also Vilnius in Lithuania. Actually, people taking over the streets, closing lanes for cars and putting sidewalk cafes so people can enjoy. And if a new cluster comes, what the authorities can do, instead of locking down all the restaurants and places, they can say, okay, you can serve outside. In California, they've been doing that for the past 2 months. They're serving meals and drinks outside, and you in all these major cities in California, and it works very well. Because as I said, the virus outside spreads much, much slower than inside, and you can space the people 2-3 meters apart from each other. But the whole rule is you take over the streets in the city. And this is happening on a quite massive scale, as I said, Melbourne, New York, and European cities, places that had no outdoor culture like Lithuania. Lithuania has a very cold winter, but nevertheless, they're taking over the city and taking over the public spaces for for safe social interaction. And the other thing is the importance of connected greenways in the city, prevention of urban farming. And now, when a lockdown comes, the first thing that is affected is food distribution. Now, with more increased local food production, that it will actually mitigate this shortage and actually lessen the gap between food distribution and it being sold in shops. And of course, promotion of agrarian residential communities, so people actually can have their little farms at their backyards and actually can have be self-sufficient if any crisis comes. So that is also something extremely important. That is one of the new sort of like guidelines for a post-COVID city. And also one thing is in addressing people in affordable social housing, high-rise towers, people that, well, don't have the private front yards, backyards, so they're dependent on the spaces around. This is why it's very important to address the third spaces in all those building complexes. And those two images show two design done by our students. They had a budget of 10,000 ringgit and they were asked to design and coordinate improvement programs to third spaces in PPR, old PPR housing complexes within Kuala Lumpur. The whole project was financed, sponsored by Lend-Lease, and they came out with really interesting solutions. And talking to them, I know they learned a lot from this exercise. So this is something that should be done across the whole cities, improve the third spaces for those people, for those vulnerable people who don't have their, who are not lucky enough, who don't have their front yards, backyards, who are stuck in that residential tower, who need some air, who need to sort of like improve their sort of like well-being, which is very much affected during pandemic lockdown. And one thing that's very obvious in Australia, Europe, and US, people, rural properties are on the rise now. Price of rural properties have hit the ceiling now. So a lot of people who can afford it are buying rural properties or building rural properties, so they know that if there's any news of a pandemic coming, they can quickly emigrate and isolate in their rural residential estate. Of course, this is something that is happening, a trend, but we must remember that planners should actually control this and ensure that the rural residential areas, which are very rural and pristine now, don't become semi-urban areas because of a lot of people building new estates. So this is something that planners should definitely control and coordinate. So that's it for today. And one thing I would like to say that, as you see, I put this Pfizer label there as one of the vaccination, pharmaceutical companies that it's as being mentioned lately. And just to indicate that the shift of power might change, because we might be with the vaccines will not eliminate the virus. They will make the virus much weaker. So people would probably have to vaccinate for a number of years. So that might actually shift the power from the existing sort of like status quo to companies that are in control of the vaccines. So that you might see the shift in power. And anyway, if you look at the equity of Pfizer and compare it to oil giants like BP or Shell, it's quite comparable. It's quite comparable. Already it's quite comparable. So that might be the shift of power. They might become one of the main decision makers of what's happening in countries, in economies, and in our urban areas. And I'd like to end this by what I heard 2 days ago from a press conference conducted by the British Prime Minister, Boris Johnson. I mean, I'm not his supporter, don't get me wrong, but he said something quite convincing. He said, let's vaccine whoever we can. Let's finish the vaccination rollout. We did what we can. We already have identified a cure for COVID, which they want to release in autumn. Let's do what we can. And after we finish vaccinating people, let's all go back to normal lives because we did what we can. And let's live with this virus, with this weakened virus, as we live with other viruses. Let's not get obsessive about it. And I think that is something promising that, well, something that we can look forward to that might happen even within this year. Okay, thank you very much.
Yeah. Okay. Thank you, Dr. Malik. That was quite a different insight totally from what we've heard from KKM, from our DG and all, and even from our government. But yeah, we have a few questions from the chat room just now as I was scrolling up and down the screen. So the first question is actually from landscape architect Ng. He's here, I can see him there. Okay. So he was asking about the impact of hot climate on the rate of the infection. So wouldn't it have any sort of, bearing on that? Because since we are in the hot climate, I think we discussed this last time, Dr. Marik, comparing Malaysia.
Yeah, well, yes. Well, basically, that's what we thought in the beginning, that warm weather was, and even when the number of infections reduced dramatically in June, July in Europe, they all thought, well, this is, of course, because of the lockdowns, because people complied, and also because of the weather. But, well, no, because if that was the case, Brazil and all of South America would have a very low infection rate. And India now, which has, India was doing quite well, and now it has this major spike, an increase, a daily increase from 20,000 to 300,000 cases, well, is an indication that that's not the case, that hot and cold weather doesn't have any influence on that pandemic. No.
Yeah. Okay. But you're talking about India just now, that despite the high rate, and they're already out of beds and oxygen across the country in India, and they still say that imposing lockdown would be the last option for that.
Well, I haven't sort of like looked in detail on what's happening in India.
Yeah.
But I remember what the president of Pakistan said a few months ago, that if he doesn't impose lockdowns, people, of course, more people will die because of COVID. But if he imposes lockdowns, he will destroy livelihood for thousands and thousands of people, because and that might kill people in long term, and more people will die as a consequences of that lockdown than because of COVID. So countries, okay, you must remember that all the countries, that United Kingdom, Australia, France, all the businesses that are closed are compensated, fully compensated. The employees get their salaries. Even the manager or the owner gets his or her salary. Of course, he doesn't make profit on it, but he is compensated. So that's why there is resistance to lockdowns, but not as much. In Eastern Europe, say in Poland, it's a different scenario. They don't get compensated. They don't pay rent. They don't pay insurance, but they don't get compensated. Their employees don't get their salaries paid. That's why in Eastern Europe there's so much clandestine restaurants operating all the time, because they have to survive. So it's, and I think in India and Pakistan it's even worse, that the repercussions of locking down are so severe that it's better actually not to lock down and try and contain it with some massive vaccine rollout and things like that.
Yeah, true that. And at least in Malaysia, we do have other measures to compensate those affected as well.
Yes,
Yeah.
yes.
Yeah. Okay, the second question is actually from Dr. Sumarni. She asked about this. How do you see the social interaction versus the social distancing becoming a new norm to us? For example, she gave a morning coffee or jogging or cycling in the group. How do you see that in Malaysia?
Well,
Since you're doing that research.
as I said, I believe very strongly that after, well, now, of course, we have to comply social distancing, but after we vaccinate 50–60% of people in Malaysia, actually, you have to vaccinate 70% of the population to get herd immunity. That's according to American health expert, Dr. Anthony Fauci. If they vaccinate 70% of the population, then I strongly believe that we should go back to our normal lives.
Yeah.
And people that are vaccinated, well, next to a vaccinated person, are quite safe to have coffee or even greet each other with a kiss or whatever. So I think that for the moment, of course, until the vaccination rollout is we should very much comply with the regulations and keep social distancing. And remember that if somebody is vaccinated, he can't go close to a person who is not vaccinated because he is safe, but that person who is vaccinated is not safe. So, and vaccination doesn't mean that the virus will not affect, it will, but your body will combat the virus, but it can affect another person who is not vaccinated. So this is the danger during vaccination. That's why it's good to impose a lockdown during vaccination. It's impossible to impose a lockdown through the whole vaccination process because the whole vaccination process is at least 9 months to a year. But it's good to definitely to keep social distancing. But after 70%, 60 to 70% of the community is vaccinated, I strongly believe let's get back to normality. Let's get back to normality. And we've got other viruses. We've got dengue, we've got influenza, we've got all those viruses that we're living with for the last year. So let's include COVID as one of those viruses we have to live with.
Okay, trying hard to do that. I think all of us. Right. I think there are no more questions, but I would like to open any other questions to the participants in this talk. I can see Architect Neo is also in. There's one Ida. If there are any questions from others, that would be great. Any more? You're allowed to unmute and ask if you need. Don't worry, Dr. Murray is a very, very friendly person, as you can see from his talk just now. He's not going to bite your head or something.
Okay, my name's Ng Chiang Lee.
Yes.
I got one more question pertaining to the planning theory, like what Dr. Murray was mentioned. We just take over the street to do whatever outside restaurant gathering. Is that also based on the concept of this finding lost space or something like that? To find a space to do it.
Okay, what they started to do, say because I've been following Melbourne and New York, is they've actually taken one lane of streets, of a 2-lane street, and converted it into outdoor space, which could be used by coffee shops if they want to serve out. If they want to serve out on permanent basis, or if a new partial lockdown comes in and they'll say, oh, you can only serve drinks and food outside, which is the case in many countries now. Italy has been doing that for the past 6 months. You can go and have your cappuccino, but outside, not inside. So basically, this is it. It's not finding new space, it's taking over space. So in a way, it's getting rid of the cars from the central parts of the city. Definitely central parts of the city and the sort of like the centers of major urban centers. So getting rid of cars, something that I know it could be very, very difficult and tricky for instance, in Malaysia, which is very much car oriented. One thing that we have to remember is that I've been in public transport, haven't been in public transport for a year. I went first time 2 weeks ago. And I must say it's pretty empty. So people now are quite scared to go into public transport because, well, public transport, unfortunately, are where you can get infected. And the fact that they measure temperatures is not sufficient enough. So it'll take some time for the people to get adjusted. I think once they get, they'll know that most of the communities vaccinated, most of the urban communities vaccinated, then they'll gain their confidence and use public transport. But this is the whole thing that we've been mentioning, to get rid of the cars, to go to the central city areas by public transport. And this will improve the pedestrian friendliness of that city, and also limit the pollution, combat the pollution. And pollution is one of the contributors to increased pandemic deaths. So it will work both ways. Get rid of the cars from the city centers. That's the only best way to create places for people.
Yeah, that sounds like as if that let's not buy cars yet in the next few years, and to see how you go. Yeah, but it may affect the car or the automotive industry when we try to reduce the number of cars, and a lot of people will tend to, and at the moment, like you said, Malaysia is much car oriented, and to move away from that normal lifestyle that we had would be quite a big
well, yes and no. See, I lived in the 70s and 80s. Australia was just as car oriented as Malaysia is now. And 40 years into the future now, nobody with his sense in his head would, if he works in central Melbourne or central Sydney, would drive there by car. They would all use public transport. And mainly because it's convenient. I mean, with a car, you've got where to park the car. Parking is expensive. So the cities actually, by imposing high fees on car parking, actually change the culture of a car-oriented community to a community that is now quite used to use public transport to go to the central part of the city, which didn't really affect the number of cars being sold and the car industry, because people still buy cars because they use cars for recreation or visiting friends or all of that. But it's the daily commuting to the city that is a problem. And I've been twice lately to KL, and I must say, after they opened the school, and I say it's worse than in 2019. Getting out of KL along Jalan Tun Razak is 1 hour.
yeah,
If you don't do it before 3 p.m., it's 1 hour. So it's really bad. Something must be done about it.
Yeah. There's one more question here. It's actually from Lamia, master student. She said, "Thank you, Dr. Marik. That was very interesting presentation." Her question is, do you believe that urban design of public spaces will need to incorporate social distancing in future planning as a strategy for design? Would it be part of it in the future, or you need to revise?
Actually, one of the qualities of urban design and public spaces is that public spaces should be robust. So if there is normal situation, we've got the pandemic virus under control, then we can do whatever we want. But if the situation worsens, the public space is robust, so we can actually impose social distancing on that public space. So this is the whole idea. This is actually one of the main principles of urban design. Urban design promotes robustness of public spaces, so they can easily convert from one option to another option. And I think this is very important. But I think to answer your question, Lamia, it's not like in the case of Malaysia, it's not a case of design guidelines, because I know that any of you would do really good design and you have done good design guidelines for you to combat pandemic for your housing complexes. I remember some of them very good scenarios. It's a matter, how do you implement them then with the existing planning legislation? That's the difficult part. And with the existing limited financial sources. Remember, Malaysia is a low tax society. It's not a high bracket tax society like Denmark, where the taxes are so huge that the local authorities have all that money for all those projects we saw in Copenhagen or Amsterdam. It's not the case in Malaysia, and that will not change. It's not only Malaysia, it's Thailand, all of Southeast Asia is a low tax countries, and that will not change because no politician will suggest increase in taxes which have been traditionally low. So we have to find other sources of income, maybe contributions from developers. That's one of the sources that they managed to find in Australia in the 1980s. Maybe increase property tax for commercial uses, not for residential uses, but for commercial uses. This is how Australian cities managed to gain sufficient funds for urban design. That's how urban design kicked off after 2000 in Australia, everywhere, because they actually increased by 4 times the commercial property taxes. Yes.
Yeah. Okay, there's one more question from Mars. Please, may I ask question how this pandemic affects new generation urban culture concept development with all these limitations? Thanks. So
well, as I said, it'll be good to interview somebody when I presented the urban culture in Europe. How, because you can limit somebody from traveling because you can impose fines if you're caught, traveling more than 30 kilometers, you'll pay a fine or something like that. But how do you impose not greeting each other like you greet now in Europe? Well, you probably can't. And I even when I interviewed people from Poland, I asked them, okay, when you meet another lady from do you give her a kiss? And the answer was, oh, if I know her well, of course I give her a kiss. So it's something that's very difficult. That's why it's extremely difficult. That's why this is one of the contributors to actually an increased number of cases in Europe.
spread.
You can impose any lockdowns you want.
Yeah,
And
yeah.
mind you, also in Europe, lockdowns and imposing restrictions can be challenged. They're unconstitutional. So politicians are taking a real risk by imposing lockdowns because they know that they might be challenged in courts by the people. So this is something also that has to be taken into consideration.
Yeah.
So it's very difficult to regulate an existing culture. Yeah, very difficult. Yeah.
Great. Are there, before we end our talk, because I think it's already 12:30 and today is Friday, many of the Muslims are going to the for the Friday prayers. So if there are any questions, one last question. If there are none, then I will wrap it up. Are there any? You can just unmute if you need to ask directly. That is fine as well. If you do not want to type. No more. Okay. Well, from all the points that you have shared with us today, Dr. Mari, I would say that it is actually very refreshing to see that you are one of the many that believe lockdown is not the actual solution to our current dilemma right now. And of course, we need to redefine for each of the countries or the states that is facing the situation, the increased numbers of cases. There has to be a redefinition of lockdown or situation, how they tackle the situation, like you mentioned earlier. For that, Dr. Mari, do you have any final words before we end?
Yeah, well, actually, in terms of lockdowns, as I said, I believed in the first lockdown, and I still do believe that logically lockdowns should work, but let's have a strategy of going out of that lockdown. I mean, locking down like they're doing in France now or Italy and extending it to 2 weeks more, 2 weeks more, 2 weeks more, 2 weeks without any sort of like indication when they will start opening up. That's the wrong approach. And
Yes.
I can see that they're slowly changing that. They're slowly now giving dates when that will finish. So there has to be a strategy out of that lockdown.
Yes.
And also, you know, if the state actually supports all the businesses throughout the lockdown, that's fine. But if they don't, then that's like in Poland, for instance, and Eastern Europe, that's getting a little bit unfair for all the restaurant owners and all the business owners, because, well, they're losing staff, they're losing everything. So
that's a big impact there. Yeah.
Yeah,
On the economy and everybody's life. Yeah. Okay. Thank you, Dr. Marek, for the talk today.
It's a
And I would
pleasure.
like and I would like to thank everybody that has attended and listened and contributed the questions. And I hope that it has been a very much enlightened talk for all, knowledge. And with that, I end the session. Okay. Thank you.
Okay, thank you very much.
Goodbye. Assalamualaikum.
Thank you.
Thank you.
Waalaikumsalam warahmatullahi.